A lot of women go to their routine doctor's appointments just for a normal checkup, and their doctor talks to them about a pap smear. And this involves getting in the stirrups. The doctor pulls out a metal speculum. It kind of looks like a duck beak, and they swab inside up by the cervix, which is just the lower part of the uterus. They send that off to the lab and wait for the results. If you have a normal pap smear, then you only have to have one every 3 years between the ages of 21 and 29. Women who are 30 or over can have a pap smear done every 3 years, or a pap smear and an HPV test done every 5 years, depending on their results in the past and their doctor's knowledge of their circumstances. They might have other recommendations depending on your history. If your pap smear test comes back abnormal, it's basically just flagging it. It means that your doctor will want to follow up and do additional testing. It doesn't necessarily mean that there are precancerous or cancerous cells. Your doctor will do additional tests, and then if those tests come back as precancerous or cancerous, know that there are a lot of treatments that can be done, and we have good outcomes for cervical cancer these days with all of the technology we have. Again, this goes back to the importance of getting screened as often as your doctor recommends, because it's all about early detection. Early detection equals better outcomes. If you have any other questions in the future for me, please feel free to ask them on our Facebook page at facebook.com/InnerMountainMoms, and recommend us to your friends and family too.